Hi everyone, my name's Jess. Today, some of our speech pathologists are going to run through some frequently asked questions about our speech pathology services.
Hello, I'm Talika, a speech pathologist from Gen Physio. So, what can you expect from the initial speech pathology session? Well, the speech pathologist will first take a case history to gather background information about the client. This is usually done collaboratively with the client and/or with their carers to help elicit a full picture of the client's underlying communication difficulties. A case history includes questions regarding their social and medical history. For pediatric clients, the case history may be more comprehensive, which includes the child's developmental milestone history and current educational support to ensure holistic management is warranted. Following this, the speech pathologist will conduct further assessment and discuss with the client and/or with their carer about their desired therapy goals to assist with planning and implementation of therapy in future sessions.
Who can be referred for a speech pathology assessment? Speech pathologists help treat and assess difficulties in speech, the way that words sound, language, the use and understanding of words and sentences, stuttering, swallowing, voice, social skills, listening and auditory processing, and literacy, reading and writing. Anyone with difficulties in any of these areas can be referred for an assessment. Concerns with speech can vary between having 1 to 2 sound errors to having speech that is very hard to understand. Similarly, language can vary between difficulties with grammar or word choice to having trouble getting any words or sentences out. Difficulties in voice may include a perceived change in voice quality, for example, noticing that your voice is more rough, or having difficulties with volume and pitch. Lastly, difficulties in swallowing can refer to having trouble chewing or keeping food and liquid inside of your mouth, choking or coughing during meal times, having difficulty swallowing your medications, or having a sensation that something's stuck in your throat. All of these difficulties can occur across the lifespan and therefore at any age and would benefit from a speech pathology assessment.
How do I know if my child needs speech and language pathology? According to Speech Pathology Australia, 1 in 7 Australians have a communication disability. This manifests in difficulties with hearing, reading and writing, speaking and understanding words, as well as using their voice. These difficulties may be present at birth or acquired later on in life. The following tips are to help you as parents decide whether or not your child needs to see a speech pathologist. You may see a speech pathologist if your child at 2 years of age is not using any words or only has a few words. If your child's speech and language or understanding of words is a lot different to what their peers are doing or their siblings at that age. You might refer if your child has a stutter, or if your child and their social skills might seem a little bit unusual or inappropriate. You may also refer if you find your child is having difficulties with their eating or drinking. This can include choking on meals, coughing during the meal times, and eating quite a restricted diet. This also is inclusive of children who don't eat all their vegetables. Many conditions may affect speech and language development in children. These can include autism spectrum disorder, developmental delays, and auditory processing disorders. For some children, the steps between milestones may be very difficult, from using babbling to transitioning to words to then go on to develop full sentences. You, as your child's parent, their expert, know your child the best. So if you have any concerns about your child's speech and language development, it's much better to see a speech pathologist sooner rather than later.